Hey, good morning, friends. It's Susan. It's Friday, so it means it's day 4 post-op for me. And I woke up at 6 o'clock this morning, not because I was ready to wake up, but because some level of fresh hell had been unleashed on my legs and it is swelling. Dun, dun, dun. We knew it was coming. So interestingly enough, does this like coincide with the drain removal that I had yesterday? Maybe, I don't know. We've been having all kinds of interesting discussions on the boards about why surgeons use drains and some surgeons don't use drains and stuff like that. But I can definitely say that I had my drains out yesterday and I woke up this morning and oh brother, are my legs swollen. So I fly tomorrow and my day today is going to consist of a little bit of walking, a little bit of trying to rub juice out of my legs, a little bit of legs on the wall, maybe a little bit of standing lymphatic yoga, just trying to get the swelling down. The first thing I did this morning when I woke up is had a little bit of protein shake and an ibuprofen, like a major one, right? Today could be Percocet day. We'll just see. But I'm okay. I mean, it's just something that you deal with. And everybody knows we all call it swell hell, right? In day 5 or 6 or something like that. So it's coming for everyone who has surgery, most likely. Anyway, so I wanted to tell you about drain removal. So I see Michelle at Dr. Schwartz's office. She's the post-op nurse and she's so good. And she listens to me chat nonstop because I talk a lot when I get nervous and when I'm not. Anyway, so I had 4 drains removed yesterday and she's so patient. She helps you take the compression off and cleans up and all that stuff and then talks to you. She knows for me, like I like to sniff an alcohol swab so I don't pass out when she's messing with the drains and stuff like that. So the top 2 came out pretty easy. They all came out easy, but they pain-free. And then she told me, she's like, the ones on your calves are gonna hurt, so just brace yourself. And so she's like, 3, 2, 1, take a deep breath, pulls it out. And it's weird, she pulls it out and then it burns like a mother. Holy cow. But then it's over and then you sit there and talk and you know, she lets you breathe and blows air on you with the fan and stuff like that. So it's all okay. So the other thing though, and of course Dr. Schwartz came in and visited with me to see how I was doing and talking about when I wanted to complete my surgeries and stuff like that. For me, I think I'll probably take the summer off because we're getting a pool and I want to be able to swim all summer. So I'm thinking maybe September I'll come back and do what's left. That way we'll know too, after things have settled in, like what big nodules are left that need to come out. So anyway, something really meaningful happened to me yesterday. Dr. Schwartz came in after he talked to me and he said, hey, I wonder if you would have a favor, that if I could ask you a favor. And there was a patient in the room next door who had had a pretty bad experience with another doctor and like really seriously afraid to come back in and get revision because it didn't go well. And he asked for my permission, he asked for her permission, you know, so there was no HIPAA stuff happening. And she came in and talked with me and God love her, bless her heart. And if you're listening to me, you know who you are. I've been thinking about you all day. Anyway, hopefully made a friend, you know, of somebody who has for the first time, like found somebody else whose legs look like hers and who has this disease and knows that it's not her fault, right? Like we've done all the things that we can do to try and lose weight or exercise or whatever, and it just keeps getting worse, you know? So anyway, it turns out that the lady and I walked out together after we both, you know, were finished with our appointments and stuff, and we stood outside and talked so long that her husband was honking the horn. So anyway, I talked to her about joining some support groups and stuff and I gave her my email address and all that too, cell phone number even. I can't imagine or remember really where I was a few years ago when I didn't know that I actually had a disease. You know, I just thought that I was a freak of nature, frankly, you know, and so it just feels good to reach out and be able to talk with somebody when they're really hurting. And you could tell, ooh, this is tough on people, you know, this having things that don't look right and normal and work right and everything. It's hard. And, you know, everybody has a burden to bear, but if you can help someone today, help someone today. You know, that's what I'm going to say. So anyway, I am off to see if I can get rid of this swelling from hell and enjoy my last day here in California. So 5-minute video. Thanks for bearing with me if you're still here. Have a great day. Bye. It's Friday. Whoop, whoop.